All right, good afternoon, everyone, and welcome to the Immunodeficiency Foundation's SCID Compass Lunch and Learn. Today's program will explore family planning and SCID. My name is Emma Mertens, and I'm the Program Manager of Community Relations at IDF. On behalf of all of us at the Immunodeficiency Foundation, I'd like to thank you for joining us today for this Lunch and Learn. We are excited to host this webinar for the IDF community. IDF is dedicated to fostering a community empowered by education. We want you to remember that IDF is committed to our community, serving you as a trusted resource through the use of technology and innovation. We are here to give you the tools and information to become empowered and offer you our compassion, understanding, and support to emphasize that you are not alone on your journey. Today's Lunch and Learn is part of IDF's regular series of bite-sized programming that will provide diagnosis-specific information and support to our community wherever they may be. Before we begin, I would like to point out a few housekeeping items to keep in mind for today's Lunch and Learn. This afternoon, we are using the Zoom webinar feature. Attendees should be able to see the slides and our panelists and to be able to see or hear myself and our presenters. Attendees will not be able to activate their video camera or their microphone. There will be the opportunity for questions at the end of the presentation. You are welcome to submit any questions you have for our panelists as you think of them throughout the session. Please type them in the Q&A box in the control panel on your screen. Please do not include any personal health information as all questions will be anonymous and read aloud. A brief disclaimer. Please remember that information presented during this forum is not intended to be a substitute for medical advice, diagnosis, or treatment. We are here today as a trusted source and friend to provide you with information. Always seek the advice of your physician or other qualified health provider with questions concerning a medical condition. Never disregard professional medical advice or delay seeking it based on information presented during an educational forum or event. Many of you tuning in today are doing so because you are an individual, parent, caregiver, or friend to someone living with severe combined immunodeficiency or SCID. SCID Compass, an educational program of the Immunodeficiency Foundation, is designed to guide parents of infants diagnosed with SCID, people living with SCID, and the medical community through the journey of learning about this rare, life-threatening medical disorder and find support to navigate the health challenges along the way. SCID Compass is supported by a grant through the Health Resources and Services Administration, or HRSA, which is an agency of the U.S. Department of Health and Human Services. SCID Compass was developed through a partnership between the Immunodeficiency Foundation, RTI International, and the Association for Public Health Laboratories, with support from Expecting Health and the SCID Angels for Life Foundation. To learn about SCID and SCID Compass, please explore our website at www.scidcompass.org. The website offers a robust variety of online and printable resources for anyone eager to learn more about this condition or share information with others. Topics cover every step in a family SCID journey, from diagnosis to treatment to return home and everything in between. It is also available in Spanish, French, German, Portuguese, and Tagalog by clicking on Select a Language in the upper navigation. SCID Compass also offers monthly and annual programming and events. In addition to our Lunch and Learns, we support all of the great programming that IDF offers to the PI community, including forums, Ask IDF, Get Connected groups, and more. We're also always thinking of ways to bring the latest in SCID to you, such as the SCID Compass Summit. We hope you'll save the date for this exciting annual event later in the spring, and that will be June 23rd to the 24th. More information coming soon. All right, and with that, I'm going to stop sharing, and I would now like to introduce our speaker for today. Brianne Miller is the Program Manager of Newborn Screening Initiatives at Expecting Health. We are thrilled to have her join us today as we take a look at family planning and SCID and get a behind-the-scenes look into the development of our SCID Compass Family Planning Guide. Welcome, Brianne.
Struggling with technology still, even this far into working from home. Thank you so much for that fantastic introduction and for inviting me here to share with you all about this project. I do want to mention before I jump in that all of this work was done in collaboration with our wonderful partners at SCID Compass and the IDF, and we can't thank them enough for their support throughout this project. So this project was completed in April of 2021. So we're going to talk a little bit about what we did. Funding disclosure, obviously this project was supported through SCID Compass. So thank you to our partners at HRSA for allowing us to do this work. Before I jump in, I also want to just say a huge thank you to the parents that took their time to candidly and vulnerably share their experiences with us. You'll see in just a second that we did a series of interviews with parents of children with SCID. And we couldn't have learned any of the information that we learned without the parents being willing to share about their experiences. So I want to start my talk with just thanking them again. So an overview of my presentation today, we'll start with a background about why we kind of jumped into this family planning after having a child with SCID project. I'll give an overview of the methods of what we did and a little bit about who we spoke to. And then results, what did we learn from our interviews, and then what comes next. So why investigate family planning after having a child with SCID? So as many of you probably know, SCID affects about 1 in 58,000 babies born. And it's now identified through routine public health newborn screening in all 50 states, which is extremely exciting. But there's not a lot known about what happens after newborn screening. So you go through the process, you have a child with SCID, and you go through newborn screening follow-up, but the support kind of falls off after that point. What happens when you want to have another child? What does that mean for you and your family? So we really wanted to look into what happens next. So our goal was to conduct individual interviews. So each of them was a one-on-one interview with our team and a parent. And these interviews were done with parents who already have a child with SCID. The parents had children at all different ages. So some were still in the hospital receiving treatment for their SCID baby, and others were 8, 9, 10 years down the road after having their child with SCID. And we really wanted to identify and address resource gaps around family planning after that experience. So we collaboratively developed an interview guide with our partners at SCID Compass and in collaboration with some parents who have experience in the area and have a SCID child. So we had this interview guide that went back and forth through multiple rounds of iterations and development. And it kind of had 9 overarching questions that really got the conversation going. And then we had several probing questions that followed up to those questions. So it had kind of these 4 sections to that interview guide here. We gave a brief introduction to the project, why we were doing it, what the interview would look like, and then consented the parents to participate. And then we kind of started with getting to know more about their journey to today. So we asked about their experience with having their first child, the diagnosis experience with SCID, all of that information. And then we really jumped into their family planning story and kind of where they were in that journey, what they were looking for, what they were hoping to do in the future. And then we asked about their positive and negative experiences, including social support, genetic services, IVF, all of those different aspects that can go into family planning after having a SCID child. And then we really wanted to jump into what resources were available to those parents during that family planning time. So who they looked to, where they turned for support, and then what they really felt like was missing during that experience. What were they looking for? Who were they looking for that they maybe were having issues connecting with? So probing through all of those different sections. So as I mentioned, we did this series of interviews. We did them throughout the month of April in 2021, which is crazy to believe that it was almost a year ago. Um, but we did them during April and they were semi-structured. So if the participants really felt strongly about sharing about an aspect of their journey, we allowed them to do so. We didn't really stick to the questions. If the interview kind of went a different way, we let it go that way, and then we would bring it back to the questions we had. So we got a lot of extra information that we probably weren't like necessarily asking for, but it was so incredibly valuable. So that's what I mean by semi-structured. They were all done via Zoom. And as I mentioned, we had 9 participants. And they were all audio recorded and transcribed, and they were also de-identified for coding and analysis. So we took all names, PHI, any indicators of location out of the data. So especially since we know with rare diseases that any indicator of where somebody might be could make them easily identifiable. So we wanted to make sure that they were extremely confidential and that nobody would be able to identify those participants. So this is what we kind of call the spectrum of family planning. We had participants all the way throughout this, and this isn't an all-encompassing spectrum by any means. But as I mentioned, we had at least one participant who was still in the hospital with their first child who was diagnosed with SCID and was really already thinking about what they were going to do next. They knew they wanted to have a big family and were having those early conversations all the way up until a family being complete. So we termed it family completion, as in they didn't want to have any more kids, or they had their additional kids and they were done having children. So we had somebody from all the way at the beginning to all the way at the end. And in between, there were a few individuals actively trying for additional children. Some had already had additional children, and we actually had one participant who was pregnant with their second child. So we had a really good variety of individuals across this spectrum. We didn't have everybody either planning or they were all done. It was a really nice array of participants. And we also recognized that there were a lot of different family planning paths among our participants. And we're not sure that this is all encompassing either. We know that there are a lot of different options for family planning. So these are the ones that we identified in our participant population, but again, not all encompassing. So we had a few participants that had surprise natural conception of additional children after having their SCID baby, just meaning that they weren't really planning to have an additional child yet, or planning to have an additional child through natural conception, but it happened. And then we also had one participant who had a planned natural conception, meaning they intentionally got pregnant naturally. We had a participant planning an adoption of an additional child, a couple participants planning for additional children through in vitro fertilization, a few that had already completed in vitro and had their second or third child. And then we also had one participant whose family was complete and they weren't planning to have additional children. So we had participants from all parts of the journey of family planning and also all sorts of different paths. So we really feel like our group of participants gave us a really good picture of what family planning could look like for a family after having a child with SCID. So after we completed all of the interviews, I mentioned that they were transcribed. We used an online service to do that. And we developed a code book to analyze the interview transcripts. I'll show an excerpt of the code book on the next slide. But we developed this code book after we completed all of the interviews, so deductively. And we chose to do this pretty early on in the process. We had thought that maybe we would be able to develop the code book prior to completing the interviews or without really reading through all of the transcripts. But after our first interview, we knew that we needed to complete all of the interviews really parse out all of those different paths where everybody was in their journey, to really code the data and make it super meaningful to us. So my partner Jamie and I developed a code book, used it to code some of the transcripts, decided that didn't work, redeveloped it, tried again. It was a pretty iterative process as well, but the final code book we landed on, we really felt allowed us to explain the data really well. So this code book was then used to code each transcript. We did this using a system called Max QDA. Basically, it pulls up the transcript and you can highlight the different sentences, statements, paragraphs, and then assign it to a code. So then you can see all the excerpts that go with that code. And then we each coded each transcript and then compared our codes together to make sure that we were reading the code book the right way, using it the same way, and also that we were interpreting the meaning of the statements the same way. So here's an example of our code book. The real document was much longer, and I just chose to not put it all on these slides. But we had different categories, including influences on family planning decision, family planning process, social support, desired resources, etc. And then the codes were motivations to have additional children, deterrence, so more specific. And they all fell into kind of these overarching categories. And then our code book actually had a more written out description of what we meant by each code and an example from the text of an interview transcript too. So what did we learn? We learned a lot. And as I mentioned, the varying pathways and everything were really helpful for us to understand the true complexity of not only a SCID diagnosis, but family planning after SCID. And the first thing that became really apparent was that not everyone had the same experience with their child's SCID diagnosis, which we kind of had that inkling going into this process. But it was really, really apparent after the first 2 or 3 interviews. We found ourselves kind of sitting there like, oh, like everyone is different. Interviewing one parent of a child with SCID is interviewing one parent of a child with SCID. So with that in mind, I want to share just some excerpts to explain the different experiences that were kind of highlighted. Newborn screening obviously is a big part of what we do at Expecting Health and also a big part of SCID diagnosis now. So we were really interested in understanding parents' newborn screening diagnosis experiences. And we were about half and half. About half of the parents were identified through newborn screening, and about the other half, newborn screening wasn't available in their state at that time. And having and not having newborn screening was one of the bigger indicators of what a family's experience with diagnosis was like, but definitely not the only experience. There was variability in each of those groups too. So this mom said, we live in a certain state, which we removed for confidentiality. At the time when their daughter was born, they didn't have newborn screening for SCID. So they were diagnosed after the fact. And that looked a little bit different than it might have for a newborn screening identified baby. Parents also talked a lot about the compounding of the SCID diagnosis with potentially being a carrier themselves and that being their own diagnosis. I really, really like this quote at the top of this screen here, like when you're a carrier, because you have your child's diagnosis and then your own diagnosis, what are you going to do with that information? The feelings of guilt or wondering how it could have happened, not knowing that you were a carrier, that was a lot. That was something that was described a lot. And that experience of going through your own medical diagnosis alongside your child's diagnosis of SCID was something parents talked a lot about. And then we also had parents who weren't carriers, whose children were random mutations caused their SCID. So this mom on the bottom here is talking about how she wasn't a carrier and it was most likely a random mutation. So the doctor was explaining that the chances of having another SCID baby were really, really low. And then the experience of diagnosis lasted all throughout childhood. So it wasn't just that the diagnosis impacted them until they had heard the word SCID or heard that their child had severe combined immunodeficiency. It impacted them all throughout their life. And those experiences looked very different as well. A few of the parents described their child went through the initial treatment for SCID and was doing great. Like this one on the top here, like he eats dirt, he goes to school, he's healthier than his peers, he's happy, just a normal little boy. But then there are also parents who described experiences like this on the bottom here of having their child be on life support in the ICU for several days at a time, long after having their SCID diagnosis. So we learned really, really quickly that everybody's experience was different. Finding two was that there are a lot of factors that go into a family's decision to have additional children after having a child with SCID. And those factors are not necessarily unique to SCID. There's a lot of factors that go into the decision to have a child regardless, but they maybe compound a little bit more, and there are a few more at play when you have a child with SCID. So we'll go through some more quotes from parents. This one is a parent really explaining that they wanted to have another child. So personal desires and interest in having a family was something that was really important. Feeling like they had this dream their whole life of having 3 or 4 kids. So that was really important to them. Or having a support system for their SCID child after potentially the mother and father weren't around anymore. So that was described as being a really important factor. And then another factor was their experience with the SCID diagnosis. So if the SCID diagnosis and treatment was a really smooth process, parents were kind of more likely to describe their decision as being easy or smoother than somebody who had gone through a really rough diagnosis and treatment experience. So this parent was describing the treatment for SCID for them was very, very smooth. So they weren't super worried about potentially having another SCID baby, as someone who had a rougher experience might describe. And they were talking about how life is even a bit harder now with COVID than it seemed at the time when they were receiving treatment for SCID. So then another couple of factors are really described here. The thought that another child might have SCID as well, like we made it through this the first time. What if we don't make it through the second time? And then impacts on social life, financial stability, things like that were also described as factors as well. So there was really a lot going into the decision to have another child, and also how to have that second child, whether it be natural conception, IVF, adoption, etc. So this is a really strong quote of kind of wondering about what could happen and how that impacts their decision to have another child or not. And then, as I mentioned, financial impact was a really strong factor, especially for parents choosing adoption or IVF, or choosing to take the risk to potentially have another SCID child. Cost of treatment versus cost of IVF are slightly different things, but kind of similar. But then also the impact that has on their potential SCID child as they get older. So this quote is something I think about pretty frequently. I think this mom was really weighing all of the different scenarios that could happen, and not wanting her daughter to think that something was so wrong with her that they would do anything to not have another child with SCID. So really a lot of really heavy and complex thoughts and feelings went into these family planning decisions. That's not something that can be described super well, other than listening to the words of these parents. So I like this quote a lot. And then another major finding was that there really is a lack of family planning support and resources for parents of children with SCID, should they choose to have another child. And we say lack of resources and support, meaning social support, financial support, educational support, all around. There's a pretty big gap in that area. So first, financial. Families choosing to go the IVF route really described a lot of financial barriers, and it not being covered by their insurance, it being expensive, like the last woman said, about $30,000. One family described taking out a personal loan to have their second child via IVF. And then this was a really, really big thing that we weren't really expecting to know, and maybe that was a bit naive on our part, but none of the benefits for IVF would trigger without an infertility diagnosis. So IVF is something that is traditionally thought of as only for families who are struggling with infertility. And we really found that the SCID families felt left out of those benefits and left out of the education and support resources available at IVF centers, because they are traditionally centered around infertility. So lacking that financial and educational, and also the staff members at the centers not being aware that, not necessarily not aware, but not super conscious that IVF can be used for other reasons than infertility. And here's a great example of staff not being super aware or in tune with other people's experiences. This breaks my heart just a little bit to even read it out loud. But this genetic counselor was really not supportive of this family's decision to have a child by IVF, and also make sure that their child was a match for their SCID child, just in case. They really described going through the whole process and spending all of the money. Why not do the testing and make sure that their child is a match if it was possible? They were very interested in having a child regardless of them being an HLA match for their child, for their SCID child. But this genetic counselor really kind of twisted that experience and made it seem that it was solely to have a bone marrow donor for their SCID child, which was really, really hard for this family. And I really appreciate this mom sharing this experience. So that is what we really mean by a lack of resources and support for SCID families in this journey. And also just educational support and resources. So people really want to make the choice that's right for them, and it just seems that there's not a lot of support in that area. And this quote kind of makes me happy, because that is something that we were able to do something about. So we really zeroed in on there's a need for a resource to support and encourage families during their family planning journey after having a child with SCID. And we were able to do just that. So I present our family planning guide for SCID families. And this was developed in collaboration with all of our partners at SCID Compass, and as a result of these interviews. So the front page is really informational and encouraging. We want every family to know that no matter what they decide, that decision is right for them. As you can see, I believe that I highlighted this quote on the next slide, so I'll save that for a second. But the front the front side is very informational, describes the different paths of family planning that we learned throughout these interviews. And then the back is really a blank space for families to write out their feelings, thoughts, and wants, needs, all of that on the back. So this quote from a mom is, "Don't let other people who don't know what's going on in your lives and in your medical lives hinder your thought process on whether or not to have children." And I think that is the perfect quote to encapsulate all of the advice that the parents gave us during those interviews. So you know what's best for your family, and don't let others discourage you from doing that. Excuse me. And these are the questions that are on the back. We really wanted them to be thought-provoking and guided by our interviews. So what do you believe are your family's greatest strengths? We're very big on strengths-based thinking. So we really wanted to have everyone sit down and think, what makes your family strong? What makes your family unique, and why, and understand why that is important, and really just think through that before jumping into what are your priorities for health and well-being, including relationships. Marriage came up a lot, mental health, financial well-being, etc. And then what worries or concerns do you have as it relates to your family planning goals? And what do you want your family to look like in 5 years? If that's having multiple more children, like how can we get there? If you think your family's complete, then that's perfect. Really guiding families to think through these things, but not making them seem like they are end all be all, or that any factor is more important than another, because everybody's factors are different in importance level for their family as well. So final thoughts. The decision to have or not have a child or children is an incredibly complex and intimate experience. And as I mentioned, this can be even more complex for a family after a diagnosis with a condition like SCID. And re-emphasizing each parent or family knows what is best for them. And then more resources and support for families wanting additional children after having a child with SCID could be helpful. So this resource isn't meant to be the only resource that ever happens in this space. It's really just the beginning of the conversation. And I also think that it's not just applicable to SCID either. There aren't a whole lot of resources for family planning for families who have a child with a genetic condition in general. So I think we can really look at in the future as a community, how do we continue to support families in that space? So if you have any questions for me after the fact, my email is on this slide, along with all of our social media channels. So if you want to stay connected with Expecting Health, please do so. And with that, I will say thank you so much for the opportunity to present today and for allowing us to be partners in this work. And I'm happy to take any questions that you might have.
Before we head into questions, we're going to go ahead and thank Brianne so much for her time today. Let me get back to our Q&A. There we go. All right. Thank you so much, Brianne, for sharing your wealth of knowledge with the IDF and SCID communities. We really appreciate you putting together this presentation and, sharing this kind of behind the scenes look at the development of this awesome resource. So thank you so much. All right, everybody, now we are going to go into some Q&A. So again, we encourage you to pop your questions into the Q&A box on the control panel on your screen as you think of them. We have one in there right now. Oh, this is just an appreciative comment. Someone said, wow, thank you so much for sharing all of these quotes from parents. These are so powerful. And I definitely agree. Those quotes were really neat to hear about. So thank you for your comment. All right, another question. Did any parents share any advice or experiences with talking to fertility experts, IVF, or genetic counselors who maybe weren't supportive or aware of all of the various options available?
Yeah, great question. And thank you. I definitely agree that all of those quotes are powerful. And I think the data really speaks for itself in that sense. So when I was thinking about how to present the results, I landed on quotes because they are so powerful. And yeah, so a lot of the parents talked about speaking with their fertility experts and feeling like that was their only route to go. That was something that a lot of IVF parents described was if they wanted another biological child, they needed to go through IVF, especially if they were carriers. So that was something they described a lot, was that feeling of this is the only option, this is what we need to do. So feeling kind of pushed into that route. And then when getting there, the experts not really understanding why they were there and being like, oh, so you're here for infertility. No, we're here because we have a child with a genetic condition. And their best advice for future parents with that was really stick to what you know and what you know you need and what you know you want, and be your best advocate. And some of them also described really, really great experiences with providers, but it took a little self-initiative in finding those providers. So one mom explained how, sorry, I hope you can't hear those sirens, explained like going to a clinic, not feeling welcome there, and then going to a different clinic and having a great experience. So really going to the clinics for your initial meetings and questions and all of that, and asking, have you done this for a family before? Do you have experience? Do you offer HLA testing? And like, what resources do you have for families with a child with a genetic condition? That was one mom's recommendation, was to really start off the conversation with, have you done this before? How did that go? What does that look like? So I thought that was really helpful.
Wonderful. Thanks, Brianne. All right, we had another question come through. Where do you even start with finding a genetic counselor or going the IVF route? Do I talk to my PCP or my OB/gynecologist, child's immunologist, etc.? Where do I get started?
Yeah, great question. The moms that we spoke to asked all of their child's doctors. So their SCID child's physician, and they had the best recommendations for IVF centers and also genetic counselors in that area.
Awesome, thank you so much. And one more question. All right, I know you said that there aren't many resources on family planning, but do you recommend any organizations for family planning or IVF more generally, not just for SCID?
I actually don't have a whole lot of knowledge about any organizations that support family planning or IVF in general. I don't know if you have any thoughts, Emma.
I know there are various organizations that work to provide free and low cost genetic counseling, and we can certainly share some more information with that in our follow-up. All right, if no one has any more questions, we definitely appreciate everyone who sent those in. Thank you so much. We will move right along. We want to thank you again, Brianne. This was such an awesome presentation, very informative, and we really appreciate you taking the time to put this together for us today.
Thank you.
To our audience, if you have additional questions, you can ask IDF. Go online and submit your questions at primaryimmune.org/ask-IDF, or give us a call at the number on your screen. We hope you'll remember to take advantage of all of the resources SCID Compass has to offer, including our family planning guide, which we learned all about today. You'll see that again there on the left. And we also want to highlight our toolkit for parents, which encompasses all of the resources and info on the SCID Compass website and a printable, easy-to-read guidebook. And parents can take it with them to medical appointments or share it with family members who want to know more about SCID. And you can find all of our resources at the link at the bottom of your screen. And we want to close by saying that all of our programming at IDF is guided by the individuals and families that we serve in our community. So we hope you'll take a moment to scan the code on our screen and take our very brief program evaluation survey. We will also be emailing out to everyone after the webinar, so please take our survey. And finally, we hope you will join us for the next SCID Compass event, where we will host a panel of several SCID carriers and adult patients to hear their different perspectives and experiences throughout their individual journeys with SCID. So a great tie-in with today's program, and we hope to see you all there. Thank you so much again, Brianne, and thank you everyone for joining us for today's program. Hope you have a wonderful rest of your day. Take care.